Doug Field, and welcome back to HealthCare Consumerism Radio. We have a very interesting segment coming up here on HealthCare Consumerism Radio. Benefit education is incredibly important as employers look to create better consumers of health and healthcare, and the transparency component is a very important part of that as well. And joining us today from Change Healthcare is Clayton Nicholas, the Vice President of Marketing and Strategy. Good morning, Clayton. Good
morning, Doug. How are you?
I'm doing fantastic. How are you?
Doing great, thank you.
Hey, we're going to see you soon, kind of in about 30 days down here in Atlanta at Forum.
Yes, I'm looking forward to it. I'm actually from Decatur, Georgia, so looking forward to getting back home.
Oh, really? I look forward to having you back here. Talk a little bit about Change Healthcare and what you folks are doing, and then we'll talk a little bit about kind of an overview of your workshop that people can come and attend at ISC Forum May 9th and 10th.
Sure. So Change Healthcare is the market leader in providing cost transparency and consumer engagement solutions. We've been around for about 5 years, founded in 2007, and with a focus to address one of the biggest unmet needs in healthcare, which is engaging consumers and really helping them make better informed decisions around their healthcare services and how they buy them. We do that through our cost transparency solutions, but also reaching out to them proactively with some novel proactive communications and messaging that we send out.
Very fast-moving space, the whole transparency piece, and obviously we can't have healthcare consumerism without that piece, correct?
Correct. It's a market that's really innovating really quickly, and I think we're seeing some great adoption of our core product, which is the ability to look up the cost of services in advance, but to really get consumers engaged, we're seeing a need to really reach out to them proactively, but also educate them on the fact that there is variance in cost in the market, and that because you're paying a higher dollar value for a service, you're not necessarily getting better quality, which is why we're doing a lot of innovation around the consumer benefits education piece.
Now, Clayton, with the around employee engagement, what kind of ROI can an employer see when that's done correctly and promoted as helping the employee population become a better consumer of health and healthcare?
Great question. So with our services, what we do is we help employees shop for their common and recurring healthcare services, such as maintenance medications, chiropractic or physical therapy services, and also to look up costs for other services like colonoscopies in advance of getting those. With those types of services, we're seeing a potential reduction in 3 to 7% of healthcare spend, and that's by helping those employees shop more effectively for their healthcare services and think about in terms of value, so getting high-quality costs but also at better prices. What we've been able to demonstrate with our services is about a 3-to-1 ROI for our clients, and that's just for services. We're able to go back into the claims data and verify that if we present one of the employees with a savings opportunity, so as an example, someone's begin a maintenance medication like simvastatin, we identify an opportunity for them to save on that by switching to mail order or switching to another pharmacy where they can get that at a lower cost. We can go back into the claims data and see that they actually switched that lower cost provider. And when we go back into the claims and look at that, we're seeing a 3-to-1 ROI for our clients.
The transparency is obviously a buzzword, Clayton, but also you hear people talk a lot about big data. And you talk about big data. And talk a little bit about that and specifically about how you talk about turning that into actionable data.
Sure. So that is a big buzzword. And I think what we're trying to do is really take big data but make it actionable data. So when we onboard our clients, we bring in claims data, both medical and pharmacy claims data. We bring in accumulator files so we know how much employees are paying into their deductible. We bring in plan benefit design data so we know what the benefit plan looks like for those members. And we bring all of that together so that we can highly personalize our solutions for each employee in that population. So when someone goes and looks for a service, they know how much they're expected to pay out of pocket at that point in time based on providers that are in network to them and what their health plan insurance looks like, whether they'd be paying a deductible or not, or how much coinsurance they might be paying. In addition, one of the things that we do that's unique in the market is proactively reach out to individuals with savings opportunities on things that they've used in the past. so we can understand based on your claims data and things that you've been paying with your healthcare services, whether you're on maintenance medications or taking other, getting certain physical, getting certain medical services, and reach out to you proactively with a savings opportunity. That provides an immediate value to that employee because they're seeing ways that they can save on services that they're already using. What we see is that when we do that, those individuals that act on those savings opportunities that we send, they're 4 times more likely to go back into our solution and then look up the cost of a service in advance. So we take that proactive approach with a high degree of personalization based on that data and being able to turn that data into actionable messages that we send. We also get a better understanding of each individual by applying analytics. So we look at the types of messages we send, whether we use behavioral economics to target messaging to members based on how they want to be communicated, and look at how individuals respond to those messages and tweak the messages that we send so that we can get the best action out of those individuals. One other thing that we do that I think is really valuable to those consumers is we only send messages based on the relevance to those individuals, based on how much they're willing to, how much they want to save. So you can, in our solution, pick how much a savings opportunity you're willing to, you want to get an alert on. You can also tell us how far you're willing to drive in order to save on an opportunity. So people are willing to drive up to 5 miles typically to get a pharmacy savings, but they'll drive a lot further to save on medical services. So those are just some examples of how we take all of this data, combine it together, and target individuals with interventions that are really specific and tailored to them.
You know, consumers like savings, so why shouldn't the same apply to healthcare consumers, right?
Exactly, and that's really one of the big thrusts in the healthcare industry is trying to push consumers into a more consumer mindset. So thinking about healthcare the way they think about buying other services, and with the big shift in costs, being put on the burden of the consumers now with high deductible plans and consumer-directed health plans, where they're paying a lot more out of pocket. You know, we're seeing the employees or the consumers now asking for this type of data to help them make more informed decisions. One thing that is different about healthcare than other services is there is a difference in terms of quality, and there's an important component of quality around how individuals make these decisions, and we build that into our solution as well.
You know, we just had on the program, the earlier segment was Lee Binder with Leapfrog Group talking about really her hospital safety score data and some pretty scary, actually, statistics about, you know, hospitals and some of the harm that can happen to individuals in the hospital. So I think, you know, the information resources like yourself really and personalized information is incredibly important to creating these better educated consumers, but also protecting these consumers.
Yeah, that's true. So we do bring in Leapfrog data as one of the components of our data.
Yeah.
We bring in other national data sources as well, but we do think that that purchasing decision for that individual is one based on value, you know, not just lower cost, but also making sure that they bring in quality into the equation, but convenience as well. As an example, making sure that people who are using the emergency room inappropriately, we can communicate messages to them and let them know where they can get high-quality care at a retail clinic or at a workplace health center that's sponsored by their employer. Making it more convenient for them, lowering the cost, but also making sure that they get high-quality care.
What do you see as the opportunity or even challenge with your solution and the, you know, exploding exchange marketplace, both private and public exchanges?
Oh, good point. And that is one of the
that was a nice, breath you caught there before you answered it.
Yeah. It is definitely a big shift in the market right now towards a more individual marketplace through both public exchanges as well as private exchanges. We see with our solution the impact that we've been able to have in terms of communicating with members and getting them to think about their health care in a more proactive way, educating them on their benefit plan types, so helping them understand the difference between a HMO and a PPO plan or a high-deductible plan. We can take those same types of communication and education capabilities and apply that to those exchange marketplaces, helping our plan sponsors, so health plans, better educate and inform employees about these types of opportunities, the employers as well. And also, if you think about an individual exchange marketplace, a lot of those, especially the private exchanges, have defined contribution models where the employee is given a fixed amount of money, and then they're responsible for figuring out how to spend that money and get the best value out of it for their healthcare services. So with our transparency solution, we can help them do that. So we see a lot of opportunity as this market moves to more towards an individual marketplace to leverage our engagement platform as a key enabler of those capabilities.
I would see the same thing. Well, listen, time flies when we're having fun. We got about a minute to go, and I would like to give you at least 30 seconds or so to kind of recap some takeaways. But again, I want to remind our audience that Clayton and his team at Change Healthcare will be at IHC Forum West or East, and we'll be conducting a workshop there. So, Clayton, if you give our audience about 30 seconds of clear takeaways from you, please.
Sure. So the market is moving to one where the individual has a lot more responsibility for making decisions around how to use their benefits. We've seen a lot of success by helping these employees understand that there are different prices in the market for services. There are different quality levels for prices in the market. By using our solution, we can help to lower the cost for them, but also lower the cost for their plan sponsors, whether it be a health plan or a self-insured employer. So by using our engagement processes and the tools we have available, we think we can help improve the quality of care in the market that members get or employees get, as well as lower the cost for all.
Well, I think you occupy a really important piece in this space, and I appreciate you being on our program this morning, Clayton, and look forward to seeing you in Atlanta in about 30 days.
Thank you. I appreciate the invitation.
And to our audience, thanks for joining us on HealthCare Consumerism Radio, and join us next week at 11 o'clock on HealthCare Consumerism Radio. Have a great week.